Ayan guys, so good evening. Good evening ladies and gentlemen, our future RNs. Magandang gabi po sa inyong lahat. For this evening, we'll be having our rationalizations po sa ating pong mga Ayan, guys. Good evening. Good evening ladies and gentlemen, our future RNs. Magandang gabi po sa inyong lahat. For this evening, we'll be having our rationalizations po sa ating pong mga sa ating pong mga good evening po sa ating pong mga sa ating pong mga Okay, we're just testing it here. Okay, so kumusta naman tayo? I know that many of you were actually having this no sa ating mga anxieties, but don't worry. Just keep the faith and hold the fast, everyone. No, keep the faith because everyone no has been there on the anxieties that we are having. So normal lang yan, and it's very very normal, and I know that, and everyone can really feel that anxieties. So yung mga uncertainties natin, yung mga nangangamba sa mga repeaters, sa mga new takers po natin in the coming licensure examination for our nurses this coming November 8 and 9. So I hope and I pray that everyone is doing well right now sa inyo pong preparation sa inyong licensure examinations. So just continue what you can do sa mga nalalibing araw, and just continue praying and still no doing hard in our study sa mga backlogs po natin, sa mga concepts na hindi pa natin nabasa. And for this time, we will be having some, you know, hobbies naman natin to, no, na magbigay ng ating pong mga um, reaction sa ating mga Q&As pagdating po sa ating PNLE concepts. And for tonight, we'll be having our PALMR. Yan, napakarami kasing nagre-request ng ating PALMR, which will be included po sa ating pong 3-day live review. So dito naman, we'll be having rationalizations no, ng few questions on our PALMR concept. Yan, kapag sinabi nating PALMR, that contains professional adjustment, leadership, management, and of course, your nursing research concept. Okay? So some of you might be familiar with the questions that we'll be giving because this is a very, very easy concept. No? Ang pagkakaiba na po ng PALMR sa other concepts po natin. Kasi in your PALMR, kapatid, kapag you already know the concept, that's it. Okay, so you don't need to think further. All you need to do is just to understand the concept. Wala siyang pathophysiology. You're not going to connect it. You're not going to think of what medication would our patient be needing, what diagnostic test our patient be needing, what are the parameters. You don't need to memorize all those things. Ang mahalaga lang dito kapag alam mo ang konsepto, you just apply it in a certain nursing situation. Okay? So let's start with of course, your first question. So I will be giving you some annotations here. Euthanasia daw is an ethical dilemma which confronts nurses in the ICU because, sabi sa letter A, the choices involved do not appear to be clearly right or wrong. Letter B, a client's legal right coexist with the nurse's professional obligation. Sabi sa letter C, decisions have to be made based on societal norms. Or letter D, decisions has to be made quickly, often under stressful conditions. So I will be giving you maybe 30 seconds to answer this one. Okay? So let's start answering this one here, right here, right now. Okay. So kapatid, euthanasia, a very, very familiar po sa atin no, na konsepto. Okay? So we have here euthanasia. We are being asked here of your concept, euthanasia. Okay? So it is an ethical dilemma, and that's true because a nurse is constrained on acting or deciding on a certain situation that is maybe not morally or ethically right according to his or her judgment. Okay? Lalong-lalo na pagdating po dito no sa konsepto ng ganito, nagkakaiba-iba tayo because of our religion, of our norms, no? So probably si nurse nag-iisip na dito ng kung ano yung sasagot niya. So ICU nurses, ano kapatid ang merong sa ICU nurses? Kapag sa ICU nurses, you immediately think no na very risky ang kanilang job description is because they're very, very prone to this euthanasia. Well, alam natin from elementary, no? It's a very elementary nursing education concept, ang euthanasia. Okay? So, sabi sa letter A, the choices daw involved do not appear to be clearly right or wrong. Letter B, a client's legal right coexist with the nurse's professional obligation. Alam nyo, automatically, merong maling sagot dito sa options na to. And I would say that here, I've been teaching about this, what we call as your dangerous term. Tandaan ninyo, quickly has to be made quickly. This is something that's very dangerous. Okay? One of the concepts na itinuturo natin kapatid sa inyong PALMR is yung types of decisions. Okay? So, there is one decisions class na tinatanong po at lumalabas pa rin ngayon sa boards, no? And this concept is which your considered decision. Okay, you write that down, your considered decisions. Okay, so kapag sinabi natin considered decisions, kapatid, these are the type of your decisions which needs time. Okay, these are decision that needs time. Okay, halimbawa ng considered decision is ang euthanasia. Okay, so kapag sa euthanasia ba, kailangan ba very quick ang ating pagdidesisyon? The answer is no. Kapatid, tandaan mo, in your considered decision, you don't need to decide quickly. Okay? So, it's not quick actually ang decision making po natin pagdating sa euthanasia. Another type of decision, kapatid, is yung tinatawag nating 10-second decision. Okay, nasa libro to ng ating L&M, Nursing Leadership and Management. Okay, kapag sinabi nating 10-second decision, kapatid, ito naman class yung ating pong type of decision which is used in your emergency situations. Okay? Used in your emergency situations. So sa madaling sabi dito kapatid, what you are thinking about is your letter D is wrong. Okay? So euthanasia is not a 10-second decision kapatid. Okay? It is actually a considered decision. Tandaan natin yan ha. Okay? Tandaan natin yan kapatid. Okay? So dito decisions have to be made based on societal norms. Tama ba ito o hindi? The answer is no. Okay? What you need to think about here is that the decision must be made upon the situation of the patient. Okay? Patient and or the family. Okay? Una, ang situation ni patient. And pangalawa, yung situation po ng family. Okay? Now, the choices involved do not appear to be clearly right or wrong. Alam nyo, our concept in your ethics and morals is clearly defined. Okay, you don't need to think na tama ba ito o hindi. Okay? So, the decisions which are based on laws, based on existing laws, based on your existing moral and society and your ethical standards are clearly right or wrong. Alam nyo, halimbawa niyan, ang napakadaling halimbawa niyan, pagdating natin sa Pilipinas. So sa Pilipinas, wala tayong batas, no, that will provide no all these legal basis on the basis of your euthanasia. Sa ibang bansa, meron ito, kapatid. Okay? So, another concept also is the same with the concept of your abortion. So, kapag wala sa batas, then it's wrong in a certain country. It's very clear. Okay? Kapag meron naman sa isang bansa, it's clear to be wrong also. So, wala na tayong dapat isipin doon. So, dito naman kapatid, okay? So, letter A is also wrong. Okay? So, letter D is of course wrong. Mali si letter D. C is also wrong. And of course, letter A is also wrong. So, the best answer here, class, that we can have is letter B is the best answer. Sabi dito, a client's legal right coexist with the nurse's professional obligation, and that is true. Okay? So, that's why sinabi, alam ninyo, ang hint po ay nasa question mismo. May ethical dilemma daw si nurse, okay, which confronts the the nurse, him or herself, because nagugulo siya because a client's legal right coexist with the nurse's professional obligation. Okay? So tandaan natin yan. So B here is the correct answer. Guys, you can actually put your comments in the comment section. Huwag kayong mag-alala, no judgment here. I know that you're also having trouble answering our PALMR questions, and that's understandable because PALMR is really a complex question. And dito, class, nag-a-appear, I know that you're in your review centers. Do not be bothered with all of those concepts that you need to memorize. All you need to do is to understand why some things are happening. Kasi pagdating po natin sa board exam, I tell you guys that 90% or 80 to 90% of what you were taught in your nursing review centers are not actually coming out in the board examination. What is being taught to you in your nursing review centers is the confidence and the proper and the scientific technique of answering the nursing board exam questions. Okay? So that's it. So let's have another question here. Okay. So sabi sa next question. Okay? I know you got it right there. So sino yung mga nakatama dyan, no? Yan. So may mga nakakasama na tayo ngayon sa ating pong live. You can actually put your comments. I don't know if this has been allowed. Yeah, may mga hello, and yan, Ayumi, Dalulo. Yan. I think may sound na. May sound ba? Klaro naman. May sound na ba ngayon? Please comment down. Doc Bry, Dalulu, Ike, Joshua, Baitan, Dan, Rockstar. Please comment down if may sound po tayo. Good morning o nga pala, no? Morning na pala. Please comment down if may sounds po tayo and if I am clear. Okay, sige. Salamat for that, Doc Bry. I think kanina wala tayong sound. Okay. Okay. So let's continue. Let's have another question here. Okay. So dito naman kapatid, okay, we'll be erasing all of our annotations here. Okay. So let's have another question. So a nurse who supports a patient's family and patient and families need to make decisions that is right for them is practicing which of the following ethical principles? Simple lang yung tanong kapatid. Sabi lang ng tanong is may isang nurse daw na sinusuportahan niya ang decisions ng family on deciding of what is right for them. Ano daw ang tinatawag nating ethical principle na ginagamit dito ni nurse? Sabi sa letter A, autonomy. Sabi sa letter B, confidentiality. Sabi naman sa letter C, privacy, or letter D, truthfulness. Okay? Put your answers down here. Okay? Okay? Ayan. So, alam niyo the big word here or the key answer or the key word here, very correct, magagaling ang mga joiners natin, no? Decisions. Automatically, alam nyo, 100% ako sure that all of your ethical principles, lalo-lalo na yung ating pong big 7 ethico-moral standards or principles will be coming out in your board exam. So it's very, very essential na alam po natin ang ating pong basic concept na ito. Uulit-ulitin ko, when I took my board examinations, my first 20 questions are basically your ethics. May first 10 to 20 questions, ethics lang po ang tinatanong sa board examination. Okay? And wala pang board examination na hindi po itinanong ang ating pong ethico-moral responsibilities ng ating pong nurses. Why it's a very fundamental concept na dapat ay alam po ng isang nurse ang ating pong ethico-moral principles. So for this one, A, autonomy, letter B, confidentiality, letter C, privacy, letter D, truthfulness. Alam niyo kapag decision po ang tinanong, you allow autonomy. Yan, kalayaan nilang makapag-decide. Okay? So, who supports family, patients and families need to make decision that is right for them is practicing autonomy. You allow them to decide on things na dapat ay dinidecidean nila. Okay? So, the best answer here is of course letter A. And you guys got the correct answer. Actually, everyone here. Magagaling. Okay? So, Ken, Elson, Ively, Rosette Maber, Modest. Of course, you guys are very good in here. Okay? So let's have another practice question here. Okay. One of the first things Miss Castro did was to engage her until in objectives writing. Okay? Formulating goals and philosophy of nursing service. Which activities are most appropriately described to which elements of administration? Okay? So sabi sa letter A, planning. Letter B, controlling. Letter C, directing. Letter D, organizing. So you put your right answers down here, guys. Okay? So, nagsulat lang daw sila ng kanilang, ang ginawa nila dito, class, is nagsulat sila ng kanilang objective, goals, and philosophy ng nursing service. Okay, which activities are most appropriately described, okay, in the elements of your administration, or perhaps we call this one as your nursing management. Okay? A, planning; B, controlling; letter C, directing; letter C, directing; letter D, controlling, organizing. Okay? So ano sa tingin ninyo? Okay? A, most are answering A's, A's, A's. Alphong, Ken, John Mark, Kalapit, Amadar, Ively, you're getting the right answer there. So the best answer here, kapatid, is your planning. Very good po tayo dyan. Alam niyo, it's a very basic concept. Pagdating po natin sa management, ang management po natin, I hope that you're getting it there. Okay? So I will be using red. Yan, siguro the dark one, the dark red. Yan. So pagdating po natin sa management, kapatid, yan, sa management, meron lamang po siyang 5 phases. O, C, and then S. Tapos may isa pang letter S yan. Okay? Sa management po, wag na tayong palilito. Sa nursing management, sa nursing leadership and management, ang leadership, puro theories yan eh. On character traits ng isang leader, or the 3 types. We have the democracy, authoritative, and we also have the laissez-faire, the laissez-faire. Now, pagdating natin sa management, kapatid, is basically a sequence of phases management na meron pong siyang phases. Una po dito is yung planning. Anong ginagawa ninyo sa planning? You focus in your M and V. Ano bang M and V na yan, sir? It's your mission and vision. Madali lang. You set your goals, you set your objectives, you set your mission, your vision. Ano bang objective ng organization? That's planning. Madaling sabi, kapatid, dito tayo nagpaplano. Okay? So, hi, Attorney Rolls. Okay, so sa madaling sabi, kapatid, dito tayo nagpaplano. Okay? So, pangalawa namang phase, kapatid, is your organizing. Okay, kapatid, kapag sinabi naman natin organizing, simple lang, the easiest keyword that we need to find here in your organizing is one word lang. Okay? It's where you recruit. Yan. Dahil na-set mo na ang mission and vision, goals and objectives ng organization ninyo, you start to organize things. You start to recruit people. You hire people. If wala pa yung recruitment, you hire people. Okay? Kapag nag-post na ng job posting sa, halimbawa, very high-tech na tayo ngayon, sa LinkedIn, sa JobStreet, okay? Sa Indeed, when your organization starts hiring nurses, it's actually the part of management which we call as your organizing. Pagdating sa board examination, ganun lang siya ipa-plot. Kapag nag-hire ka, ang tawag natin doon, organizing. P, planning, you write your mission and vision. O, may mission and vision ka na. Next is O, PODCSS. Okay, organizing, wherein you recruit or hire your nurses. Pangalawa naman, kapatid, is yung tinatawag po nating directing. Dahil na-recruit ka na, nag-hire ka na, actually, yung pinaka-big word natin dito is your orientation. You orient them. Okay? You orient them. Siyempre, nakapag-hire ka na, directing is the first step towards making them your part of the organization. Okay? Pangalawa is your controlling. Sa controlling naman, kapatid, dito na nangyayari ang inyong coaching. Ayan. Okay? Dito na nangyayari, kapatid, ang inyong dito na nangyayari, kapatid, ang evaluation. Yan. Evaluation. Diyan na nangyayari ang inyong diyan na nangyayari ang yung how do you call it, evaluating the performances of your nurses, and also trying to tell them that you need to improve on your spaces, that you need to improve on your areas of specialization. Halimbawa, kung delivery room nurse yan, you need to do more trainings in your delivery. Okay? Another is your staffing. It's where you put your nurses. Okay? Put nurses in areas, okay, of strength. Yan. It's what we call as your staffing. Okay? Hindi ka maglalagay ng bagong nurses in the emergency room. Hindi ka maglalagay ng bagong nurses in your ICU because those are highly specialized areas. Okay? Now, and last but not the least is your scheduling. Okay? Pagdating sa libro ni Lydia Benson, kapatid, ito po yung ating pong pag-aaralan, which is we should put this one in a separate lectures. Lalo-lalo na pagdating po natin sa 3-day live review po natin. Okay? So yan, magagaling. Okay? So dito, dahil you've set your goals, philosophy, you have written all those things, plinat po natin, that's what we call as your planet. Okay? Yan, magagaling. Okay, so let's have another question here, kapatid. In recognizing the Department of Nursing, she comes up with the organizational structure defining the role and function of the different nursing positions and line up the position with qualified people. This is included in which element of your administration or your nursing management? Kasabi lang natin. Okay? Saan yan, kapatid? Saan yan? Okay, she comes up with organizational structure, defining the role and function of the different positions, and line them up, kapatid. Okay? Okay, kapag po organizing, very good question from Ken Rojas. Kapag po organizing, same rin po yan nung staffing po. Okay, pagdating sa organizing, yes, component siya actually ng ating pong ng ating pong rather ang staffing po is component siya ng ating organizing. However, if the question is asking you specifically no for a specific type of staffing, kasi most of the time tinatanong po ang staffing if what is the type of the staffing that is being asked. Halimbawa, primary nursing, pagdating po natin sa staffing, we have your team nursing, the division of labor, all of those hints. Okay? So, every time na binibigay po sa PNLE ang question on staffing, it's always put in a separate concept. But if you are just being asked if what part of management, kapatid, you answer organizing. Very good question yan, no? Okay. So, dito kapatid, she comes up with organizational structure, defining role and function of the different person, line up the position with qualified people. Line up the position with qualified people. What do you think is the answer here? I want to see answers. What do you think is the answer here? Because it's kind of tricky here, kapatid. What do you think is the answer? Yan. Is it monitoring, evaluation, organizing, planning? The best answer here, alam natin kapatid, kasasabi lang natin, it's not monitoring, it's not evaluating, but it is actually organizing. Very good tayo dyan, kapatid. Kasasabi lang natin yan. Okay? Ayan. So your monitoring and evaluation, they're actually the same concept. Again, pinag-uusapan pa lang natin in your top score method, you can't have two correct answers in one question. They're actually what we call as your incompatible options. So hindi po tayo pwedeng mag-rally sa harapan po ng PRC and then ay reklamo po natin na dalawa po yung sagot doon, no, we cannot do that. You are constrained to put an answer in every question. Okay? So very good tayo doon. So let's have another question here. Next question, kapatid. Ayan. Sabi dito, which of the following persons cannot have the access to the patient's record? Ayan. Laging yun, kapatid, basic question if who are those persons entitled? Alam nyo, pagdating po dito sa no-brainer question, only those who are members or currently taking up the care of the patient, lahat po tayo, lahat po ng members ng ating pong healthcare team, yan. And of course, yung ating pong yan, yung ating pong patient himself, yan, at ating pong members of the healthcare team, yan. Which of the following persons cannot have the access to the patient's record? I want to see answers here, kapatid. Yan. Sabi sa letter, lawyer of the family, yeah. Briefly, if you're going to see the question as it is being asked, okay, very simple lang po, okay? Very simple ang question, ang atake ng question natin dito, which of the following persons cannot have the access to the patient's record. Ang nangyayari kasi dito sa ating po mga nurses, we always think outside the box. Sir, paano po kung sa korte na po ito? Wala pa pong sinasabi ang tanong, no? According to the book of Lydia Venzon and also all of those books by Shales and the leadership and management books that we have in the NCLEX also as a standards of the Western nursing education. Okay, so only those who are members of the healthcare team have the right, okay, to access the patient's record. Okay, so here, kapatid, physical therapist, yes. Member of the healthcare team, lawyer the family, no. Patient himself, yes, of course, the patient can request it. Speech therapist, also a member of the healthcare team. So except, of course, the uh, lawyer of the family. So we are looking for the wrong answer here, cannot have the access to the patient's record. So we answer letter B, lawyer of the family. Okay? So tama naman tayo doon. Okay, let's have another question here. Okay. So, what is the function of the primary nurse in the primary nursing? Ayan. So, dito na yan. This is the type of staffing that um we've tackled just earlier, no? So, ano daw ang role ng isang primary nurse? Okay? What is the function of the primary nurse in primary nursing? Okay? So, letter A, acts as patient advocate and coordinate the healthcare team for a specific group of patients. Letter B, act as the charge nurse, organizing staff assignments and help in solving problem in the unit. Letter C, cares to her from admission to discharge. Or letter D, coordinates the care given to a group of patients by a support staff. Okay, I will be giving you 30 seconds to answer this one. Okay? So, sige, 30 seconds for you to analyze and answer this one. Okay? So, let's answer this one here. So, ano daw ang role ng ating pong primary nurse in your primary nursing? Yan. So, again, primary nursing is a type of your staffing. Okay? It's a type of staffing model that we use in your nursing. It's in the book of Lee Venson. Lee Venson, why I tell you, Lee Venson is a very important book. 100% po ng ating PALMR questions will be coming from Lee Venson book. Lee Venson and Rolando Venzon. Okay? The Venzons have really summarized all of the books, no? In the international nursing education standards. Okay? So, now, ano daw ang function ng primary nurse sa primary nursing model po na ito? Alam nyo, napakasimple lang po ng ating pong primary nursing po na ito. Kapag sinabi po nating primary nursing, si primary nurse, yan, from the word itself, mayroon po tayo ditong primary nurse. Si primary nurse po is the nurse. Okay, I will write it down here. Okay? Nurse, the nurse here acts, okay, as an overall, okay, overall, okay, planner, yan, yan, okay, planner, coordinator, yan, planner, coordinator, and also, okay, planner, coordinator, and facilitator. Yan. Nagpa-facilitate din po dito si nurse. Okay? Si primary nurse to of care. Yan, tandaan po natin. The planner, the coordinator, facilitator of care to a patient. Yan. Or group of patients. Yan. Okay? To a patient or group of patients, kapatid, na kung saan, okay? Okay? Care to group of patients. Yan. Okay, to carry out, okay, carry out nursing care. So basically, kapatid, meron tayong primary nurse who is the overall planner, coordinator, facilitator of care to patient or group of patients to carry out nursing care. Okay? So alam mo dito, we have, if you're going to look at every options po natin dito, titingnan ninyo dito yung ating pong options. Hala sir, pare-pareho naman sila. Act as patient advocate and coordinate the healthcare team for a specific group of patient. Letter B, act as a charge nurse, organizing staff assignments and help in solving problem in the unit. Plans and coordinate the patient care assigned to her from admission to discharge. Letter D, coordinates the care given to a group of patients by support staff. Sir, parang, yeah, parang lahat naman to no? But alam nyo, in your primary nursing, nagkakaiba-iba siya sa inyong it's very different to your other care models. It's because we have this primary nurse. Okay? In your functional nursing, kapatid, think about this one. Okay? I will be putting, para madali po nating masagot ang questions about your staffing concerns or staffing models. Okay? So, let's start with your functional. Okay? Kapag sinabi nating functional, kapatid, very simple. From the word itself, functional. Okay? So, from the word itself, kapatid, functional, anong meron dito class sa ating pong functional type of your model in your nursing care? So, kapag sinabi po nating functional, kapatid, ibig sabihin, there is a team leader, si TL dito, may TL dito, kapatid, and meron po siyang tinatawag na mga auxiliary nurses. Okay? May TL dito, tapos meron tayong tinatawag na auxiliary nurses or yung ating pong auxiliary nurses, o minsan in the United States or in the Western countries, they are your LVN or your licensed vocational nurse, or we also have dito yung ating pong unlicensed personnel or yung mga UAVs po natin. But in the context of your Philippine healthcare setting, we have your nursing attendant, or you also have your nursing assistants. Okay? So sa functional, meron pong tinatawag na team leader, at yung team leader po, so dito sa functional na to, parang nakikita natin siya, kapatid, dito po sa ating pong letter D. Okay? It's like a functional. Okay? Functional nursing model. Okay? So sabi naman dito sa letter C, plans and coordinate the patient care assigned to her from admission to until discharge. Imagine, so ikaw ang nagpaplano, ang nagko-coordinate ng pasyente. So ibig sabihin, from the moment the patient has been admitted until discharge, kapatid, okay, ikaw yung you have the care to this patient, everything, performing EKG, performing all of those laboratory assignments, yan, from the moment of assessment until evaluation, ikaw. Okay? So dito, kapatid, it's what we call as your, dito naman, kapatid, it's what we call as your, okay, it's what we call as your patient, yan, patient focused, yan. Ito yung tinatawag natin patient focused care. Okay? Patient focused care. Okay? So, ito, minsan tinatawag siya actually na comprehensive nursing care. Okay? While in your letter B, okay, sa inyo namang letter B, kapatid, what is this type of your care? Sa inyong letter B, yan. Sa inyong letter B, kapatid, act as the charge nurse, organizing staff assignments and help in solving problem. Okay? Kung kapag problem solver ka, kapatid, yes, it can also be a primary nursing care, can also be a functional auxiliary care, can be patient-focused care, because anywhere, kapatid, you can be a problem solver. Okay? However, kapatid, no, act as the charge nurse. Ayan. You are not the charge nurse here. Okay? Because ang charge nurse po na ito is also a nomenclature na makikita po natin, kapatid, sa inyong functional. Okay? Or minsan we call that one as nasa team nursing din po ito. Okay? So this can be found in your TN or minsan po kapatid nasa functional nursing din po siya. Okay? So kapatid dito the best answer that we can have is of course letter. Yan. Act as an advocate. Yan, ilagay po natin. Act as an advocate and coordinate the healthcare team for a specific group of patients. Tandaan niyo ha, it can be a patient or specific group of patients. Okay, that's what we call as your primary nurse. Okay, so that's it. Let's have another question here. Okay. Okay, I'll try to erase this one here. So, okay. So, primary nursing daw is most advantageous and satisfying to the patient and nurse because of which of the following principles? Letter A, autonomy and authority for planning care are best delegated to a nurse. Letter B, accountability is clearest since our nurse is responsible for the overall plan and implementation of care. Letter C, holistic approach provides for a therapeutic relationship, continuity of care and efficient nursing care. And letter D, continuity of patient's care promotes efficient nursing care. Alam niyo kapag sinabi po natin kapatid na primary nursing, that is equivalent to your accountability. Tandaan natin, primary nursing is equivalent to your accountability. Okay? Primary nursing is equivalent to accountability because you alone, yan, yung sinasabi po natin dito. Okay? Accountability here is clearest, kapatid. Okay? So letter B is the best answer. Ayan. Accountability is clearest. Okay? So dito, kapatid, in liking your team nursing from the word itself, team, there is a team. Okay? Unlike also in your functional nursing, the labor is divided. Okay? In your primary nursing, it's one of the most conventional and classical actually na type of your nursing care. So, yan. Accountability here is clearest. Okay? Yung mga ginagawa po natin sa halimbawa sa ating pong mga home care or say for example in Thailand, one of their best practices or one of the best part of their healthcare delivery system is that they have these primary nurses. Okay? Kasi meron po silang mga tinatawag po nating home admission setup. Okay? Meron po silang home admission setup na kung saan po yung kanilang mga pasyente ay nasa bahay lamang po pero naka-hospital bed po sila. So we have our primary nurses there. Okay? So ayan. So yan. So let's have another question. What is the role of the associate nurse in primary nursing? Ito. So mayroon po tayong tinatawag na associate nurses in primary nursing. So ang tanong dito, ano ba yung mga roles po nila? Yan. A, overall manager of the unit. Letter B, responsible for overall care of the patient during off days of the primary nurse. Letter C, yan. Letter C, kapatid, patient advocate in healthcare team. Letter D, coordinator of comprehensive holistic care. Yan. So, what do you think is the answer here? A, B, C, or D? Yan. Ito lumabas daw in the boards and many actually got correct as, mistaken. Okay? Nagkamali po dito, no, kapatid, pagdating dito sa tanong na to. Okay? So, what do you think is the answer? Yan. So, si associate nurse daw dito, oh. Associate nurse. We're talking of the associate nurse. Okay? So, what is the role? What is the clearest role? Okay? Tandaan ninyo, nag-iba lang. You gotta be applying here all of the top score method that I taught you guys. Okay? So, alam ninyo, ganito lang yan. Ganito lang siya kasimple, kapatid. Si associate nurse na ang tinatanong dito. It's not the primary nurse. Okay? Hindi si primary nurse. You just need to look what are the roles of the primary nurse and you think of what are or what is that role that is not anymore of a primary nurse. Okay? So overall manager of the unit, alam mo si primary nurse yan. Okay? Si patient advocate in healthcare team, katatanong lang kanina, alam mo si primary nurse yan. Coordinator of comprehensive holistic patient care, tunog primary nurse din, di ba? Okay? So, the best answer that you can have here, kapatid, associate nurse. Okay? So, what do you think is the secondary role? If in the absence of your primary nurse, who will take charge? Okay? Who will do the things? Who will do A, B, C, and who will do A, C, and D? So, it's the associate nurse, kapatid. Okay? So, responsible for overall care of the patient during off days of the primary nurse. Very simple. Ganun lang po ang role po ng ating pong associate nurse. Kapag wala po yung ating pong main character, the primary nurse, then the associate nurse will take over. So B is the correct answer here. Yan. So magagaling, magagaling. Okay? So let's start. Let's have another question here. In primary nursing, the nurse is responsible for which of the following group of patient? Ito alam nyo, very specific din dito ang libro. Actually, ang book po natin is very specific din pagdating po dito sa number na to. Okay? In your primary nursing, ilang lang daw ang allowed. Alam nyo, very specific po ang book dito. All you just need is to memorize this one. Ito po yung mga konsepto na kailangan natin i-memorize. Pagdating po sa numero, in your PALMR, may mga numbers po tayo dyan. Your patient-nurse ratio, halimbawa dito in your primary nursing. Pagdating naman po sa ating mong medication, of course, you need to memorize all of those computation and all the rest you need to understand. Therefore, nursing is a non-memorization concept. So, alam nyo kapatid, it's very easy. Okay, pagdating po sa ating primary nursing, ang allowed lang po for the patient to be handled is a maximum of 5 patients. So 3 to 5 patients, kapatid, for your primary nursing. Okay? Ayan, 3 to 5. Very good tayo dyan, Aaron. J-Boy Juanico, Nicole Villanueva, A. Castañas, Rosette May Bermudez, 42. Na, padami na ng padami, kapatid. Yan. So, magandang umaga sa inyong lahat. Okay. So, I hope you guys are learning a lot from here. Okay? So, let's continue. The Philippine Nursing Act delineates the scope of nursing. It specifies that independent practicing nurse is and prevention of illness. Letter B, administration of written prescription for treatment and therapies. Letter B, rehabilitative aspect of care. Letter D, collaborating with other healthcare providers for health restoration and alleviation of suffering. Alam mo kapatid? Okay? The Philippine Nursing Act delineates the scope of nursing. It specifies independent nursing act. Ano sa tingin mo ang sagot dito? Health promotion, prevention of illness. Okay? What do you think, kapatid? Okay? Sige nga, I will be waiting for your letter A, letter. Okay? I will be looking at your answers. Okay. Alam nyo, specifically kapatid, ayan, okay, I saw all of those correct answers kapatid. So, specifically kapatid, ini-specify po yan sa batas. An independent practicing nurse is responsible for, ayan, wala na po tayong ibang sagot dito. You need to think that the primary responsibility of the independent practicing nurse is health promotion and prevention of illness. Okay? You're thinking, that's why basically kapag tinatanong ka, nasa community ka, nurse, or kapatid, or friend, or besh, ano nga bang gamot dito? Yan. So basically, sinasagot mo always letter B, and that's very, very wrong. Okay? So you need to think that it's not your role. Okay? As an independent practicing nurse. Alam ninyo, again and again and again, kahit hindi mo alam ang sagot dito, kahit you don't really have enough by concept concept where you don't have a concept-based knowledge here, you will not answer letter C and letter D. They're actually the same answers. Okay? So letter A is the best answer dito, kapatid. Okay? I know you're getting yeah, the correct answers by using the top score method. Yan. So magagaling. Okay? So let's continue here. Yan. Hi, how many days to go? As a standard in ethics, this represents an understanding and agreement to respect another person's right to decide the course his or her own destiny. Yan, alam natin yan. Decision, decision, decision. Kapag decision ang pinag-usapan, kapatid, the very first question that we had here, ano nga ba kapag sinabi nating decision, kapatid? Yan. Okay, we are allowing the patient to decide his or her destiny. Okay? That's what we call as your autonomy. Yeah, of course, autonomy is the correct answer here, kapatid. Okay. No-brainer question. Okay. So, another question. Which of the following is not a legally binding document, but nonetheless, very important in the care of all patients in any setting? This is a repeated question actually in one of the past board examinations. I think ilang ulit na tong tinatanong sa boards, no? If it's a non-legally binding document, pero ginagamit siya sa standards in our patient care, alam natin yan, kapatid, that it's the Patient's Bill of Rights. Okay? As adopted in the ANA or the American Nurses Association. It's in the books. Nasa libro po natin yan, kapatid. Okay? Patient's Bill of Rights. Ayan. Okay? So, yan. It's actually kumbaga it's an engraved. It must be engraved in the DNA of our nurses to always respect the patient's Bill of Rights. Okay? So, dapat alam natin yan. Ayan, very good tayo dyan. Okay? So, let's have another. Kay, a 25-year-old woman computer sales agent, was raped on her way from home one evening. The rape occurred in the parking lot owned by the company she is working for. Jonathan found her lying on the ground, and in the emergency room area, she was admitted and told the nurse that she was raped. Which of the following actions is the most important for the emergency room nurse to take? Letter A, call the police officer. Letter B, provide safe environment. Letter C, call case relatives. Letter D, protection from pregnancy. Ayan. Alam niyo, this is an NCLEX-based question. However, it doesn't seem to be um, directly, no? The options are not NCLEX based, but the question is an NCLEX based question. Simply, anong gagawin mo, kapatid, kapag nakakita ka ng babaeng uh, uh, halimbawa, no, on this case, no, she was telling you that she was raped in the emergency room and you are an emergency room nurse. Okay, what do you think is the answer? Letter A, call the police officer. Letter B, provide safe environment. Call case relatives. Letter B, protection from pregnancy. Okay? Ayan. Sa mga sumagot po ng letter, ayan. What do you think is the answer? This is tricky. May gusto sumasagot ng letter A. Yan, may sumasagot ng letter A. Call the police officer. Okay? Provide safe environment. Yan. Yan. Alam nyo, um, it is actually confusing if you would be looking at this question as an NCLEX based questions, because kapag NCLEX talaga ang gamitin mong standards dito, kapatid, ay nako, it would be a different story. But the correct answer here, kapatid, is ito ha. I will not be confusing your minds because you will be taking the Philippine Nurse Licensure Examination. Remember, it's the Philippine Nurse Licensure Examination. What do we do in the Philippines? Okay. So which of the following actions is the most important for the emergency room nurse to take kapag may isang babae yan na dinala sa emergency room at sinabing na rape ang babaeng ito? Okay? The first thing that you must be thinking about, wala pong iba, safety of the patient. You think of the safety. Priority is your safety. Okay? So tandaan po natin dito, kapatid, although it's very generic, letter B is the correct answer here, kapatid. Okay? Letter B is the correct answer dito. Although, again, ulitin ko, it's a very generic option. But if you will be looking at the options na paano naging safe ang patient? Paano naman, halimbawa kapag nasa options na at wala po yung provide safe environment or provide safety space for the patient at may nakita ka doon na provide the patient a quiet room, provide the patient a quiet and clean room. That's the answer, kapatid. Okay? So, although the option is giving us a very generic option, kapatid, it's the correct answer. You provide safe environment. Priority natin dito, kapatid, is safety po ng patient. Remember that your patients who have just been a victim of crimes against chastity, like dito, rape cases, it seems very, very unsafe for them to sit down anywhere. So you need to think of the psychological impact of the incidents. So the first thing that you must think about is also the physical and the psychosocial, yung emotional din na nararamdaman ng ating pasyente. So you provide safe environment. You think about that, kapatid. Sir, if NCLEX ba, A, if the Philippines B, the answer is actually correct because letter B, dito actually, yes, dito ha, which of the following action is the most important for the emergency room nurse to take? If you will be answering this in in a very NCLEX manner, nagkakaiba-iba din, kapatid, because may mga state laws po. No, but if if you will be answering this one in an NCLEX manner, you must not necessarily call the police, but you call the social service. Yun yung tawag sa kanila, eh, social service. Dito kasi sa atin, we have our social workers, eh, but um not safety based yung kanilang roles, but yung social service po na tinatawag natin in the United States, in some specific states, kapatid, it's very emergency din yung kanilang response. It's like the 9/11 for us, but it's the social service. It's like it will give the patient the safety protocol. Okay, yun, social service or the safety protocol officer. Those are the persons that you might be calling if this happens in the United States. But don't worry, guys, you will be taking the Philippine Nurse Licensure Examination. You answer questions plainly. Okay, kasi wala tayong ganung protocol dito. Well, in the United States, kapatid, because what they do is really in the books. You need to answer that one. Okay, yung safety protocol, you need to follow the safety protocol, the safety officer. But in the Philippines, you just need to think and to look at questions the way they are written in the books. So you provide safe environment. Ganun lang siya. Okay? Kaya pala, sir, when I search for the rational, iba ang sagot sa NCLEX than the PNLE. Yeah, and that's correct. Totoo yan. That's why I always advise my students, because you will be taking the Philippine Nurse Licensure examinations, to please, please, please always refer to PNLE-based references. Okay? That's why ini-encourage ko ang ating mga estudyante to always refer, lalo-lalo na pagdating sa PALMR, kapatid. PALMR ha, sa PALMR natin, nasa professional adjustment po na component po ng PALMR, ang mga existing laws and legal aspects of nursing care. Iba po ang mga batas sa United States at iba po ang mga batas sa Pilipinas. Okay? So, sa professional adjustment na component, mag-base po tayo sa Philippine healthcare setting. Okay? Pagdating sa L&M, Leadership and Management, you can use all of those concepts that's used in the NCLEX. However, in the practical application, okay, of our nursing concepts, so magbe-base pa rin po tayo sa ating pong Philippine healthcare setting. Okay? Sir, everyday po kayo nagla-live like this type of videos po. Not really, but nakikita ko na mas marami tayong matutulungan on this, no? So, more of these, no? So, I hopefully, no, we will be having those times. Okay. Yeah. Maraming salamat for those questions. I'm quite enjoying for our live today. A. Castañas, thank you for that. J-Boy Kwanico, Matcha Mochi. You guys are very good on that. Okay. So let's have another question. Nurse Joseph loves photography. He was so happy seeing baby Madel, so he took a picture of the baby while his coworker took a pee. He then sold it to a magazine. It was published the following month. Nurse Joseph can be sued for letter A, defamation, letter B, illegal detention, letter C, invasion of right to privacy, letter D, battery. Okay? So, this is also a generic prof ad concept. Yan, pagdating po sa ating po mga cases. Okay? Yan, sa ating po mga torts, yung mga intentional wrongs po natin. So, what do you think is the answer here? So, no-brainer, kapatid. So, simple lang yung tanong, no? Alam niyo kapag nahihirapan kayo in understanding, lalo-lalo na because our questions in the PNLE are written in English or specific language. So, you just need to translate the question into Filipino or Tagalog or kahit na anong lingwahe na hiyang kayo so that you would be able to understand the question. Okay? Yan. So, what do you think is the answer here? Kinuna ng picture yung baby, okay? And then it was sold to a magazine. Of course, that's what we call as your invasion of right to privacy. Okay? Invasion of right to privacy. Okay, so that's the correct answer. So C is the best answer here. Everyone's getting the right answer here. Yeah. Thank you, thank you, thank you. Yeah. So let's have another question. Nurse Anna Marie is talking to a nurse, to Nurse Charlene in a cafeteria. They were saying that Dr. Melvin is a womanizer who, because he gets all the nurses in the NICU, even though he's already engaged. They say that his license must be revoked. What tort is Nurse Anna Marie can be held liable of this one, liable of. Okay? So what do you think is the answer? Yan. Minamarites ninyo si Doc Melvin. Letter A, libel. Letter C, slander. Letter C, defamation. Letter D, assault. What do you think is the answer? Letter B, slander. Okay? Very simple lang, kapatid. According to the book of, alam nyo, napakasimple lang ng differentiate dito ni Venzon. Yan. Uttered. Kapag sinabing uttered, spoken, yan. It can be uttered, spoken, libel naman, kapatid. These can be, yan, written, yan, illustrated. Okay? Yan. Ayan, very good tayo. Okay? So your defamation can be separated into two. Okay? I mean, can be classified into two. We have dito yung ating pong slander and we also have your libel. Okay? So your defamation can be oral defamation or your written defamation. Okay? So slander, it's your written defamation while your, utter defamation or spoken defamation while your libel is your written defamation. Okay? Slander, salita, libel, lapis. Ang galing naman, no? Sige, sulat natin yon. A. Castañas. Okay? Yan. Yan. Alam nyo, ang defamation po natin, that's classified into two. Your oral or your slander, or your written or your libel. Yan. Salita, and then lapis. So, very good tayo doon. A. Castañas. Okay? So, the best answer here, because narinig po nila na nagsasalita or nag-uusap yung dalawa, si Nurse Anna and Nurse Charlene in a cafeteria. So the best answer here, kapatid, is of course, no? Of course, the best answer here is letter B. Okay? B is the correct answer here. Yeah, it really happens, no? Nangyayari to, no? Halimbawa, pinag-uusapan natin yung doktor na, yon, ang kupad ng doktor, ganyan. So, we know. Okay? You do this sometimes. You're not perfect. Okay, so you can do that. So let's have another question. Nurse Giselle went ahead and decided to administer the medication to Mr. Badilio. Okay, so Mr. Badilio, on the other hand, refused to have the medication because of its side effects. However, Nurse Giselle insisted, and when the patient went to sleep, she injected the medication to the patient. This is an example of, alam niyo, very simple lang to. I know you know this one already. Yung ating pong, ang pagkakaiba po dito is yung Azolt muna tayo. Sa Azolt dito is yung ating pong Azolt, no? This is the classification dito, kapatid, sa set of intentional wrongs natin dito, na kung saan ito namang sa assault nito, ito po yung tinatawag po nating threatening, Yung ating pong magkapatid kasi dito eh, no? Si Azalt po kapatid at ang ating pong battery. Yan, si Azalt and battery. Kapag sinabi naman natin battery kapatid, this is what we call as your unconsented touching. Yan. Okay? So, what do you think is the answer here? Yan. So, ibinigay mo yung medication kahit hindi niya naman gusto. Or, yan, very good. Napakarami. Battery without consent, yan, unconsented touching. So, binigay mo medication kahit hindi naman consented. So, the best answer here is, of course, no, we know this one. It's battery. Okay? Ready na. Parang ready na yung ating mga viewers to take the licensure examination. You guys are ready. Yan. So, yan. Okay? So, I think we'll be stopping at question number 50, number 20. So, we are now at your 16. So 4 more questions. Okay. So let's have another question. Okay, ito naman. A client overhears two nurses talking about the incompetence of his physician. The nurses will be held liable of letter A, malpractice. Letter B, invasion of privacy. Letter C, assault. Letter D, character assassination. This is kind of tricky question, ha? But I know this is easy. Yeah. I saw another option, sir, about trespass to person alongside battery and assault. Ano po siya? Trespass to person alongside battery and assault. I can't get the context of the question. Okay? Kinakabahan pa, sir. Yeah. Alam niyo, huwag kayong kabahan. Your preparation from the first year must be bigger than the 500 item question that you will be facing in the licensure examination. The moment you graduated and your clinical instructor told you that you will be passing, no, that's the moment. That's the clincher, guys. You must have faith. So the best answer here, kapatid, is of course character assassination. Very good tayo dun. Character assassination is actually the same as your slander or your oral defamation. Okay? So dito talking, they were talking. Yan. Very simple po yan. Okay? Yan. So let's have another question. Coercing a patient into taking medications by imposing punishment could legally be considered as what? Yan. Yan. Kung kino-coerce mo daw si patient, pinipilit mo, no? Yan. So what do you think is the answer here? Yan. Pinipilit mo, ha? Pinipilit mo. Letter A, assault. Letter B, false imprisonment. Letter C, battery. Letter D, probable cause. What do you think is the answer? Okay? Ayan. So, coercing a patient, pinipilit mo. Wala namang sinabi dito na ginawa mo sa pasyente. Ang sinasabi dito is the nurse is trying to impose punishment. Hala, sige ka, kapag hindi ka or hindi mo i-allow, no, na naibigay namin sa iyo yung medication na to. Sige ka, you will be paying all of your expenses in the hospital. Hindi namin to i-cover sa PhilHealth. Yan. So, hindi po natin pwedeng gawin yun. That's actually assault. Yan. Very good. Okay? Assault. Yan. Assault po. Letter A is the best answer, kapatid. So, this is actually common, no? This is a common scenario in the Philippine healthcare setting which involves nurses. So, assault po ang nangyayari dyan. Ito, the doctor assigned to the patient was also sued together with the nurses. When it was his turn to take the stand during the next hearing, he was told to bring him a copy of the patient's chart. The hearing officer will have to issue what legal order to bring the patient's chart. Letter A, warrant of arrest. Letter B, subpoena ad testificandum. Letter C, subpoena duces tecum. Letter D, injunction. What do you think is the answer? This really sounds legally for me, but this is an easy question because we just have two of these documents that are easily issued by the court for nurses to make appear in the courts. Yan. I mean, sir, the choices available are assault, but there is also third choice, trespass to person. Okay, trespass to person. If the actually battery and trespass to persons are actually the same option. C, of course. Okay? So ganito, simple lang. Dito may dalawa po tayong sa pagdating po sa PALMR, may dalawang types of documents na ini-issue sa nurses wherein they will be required to appear in a court hearing. Yan. So dito, you will be required just to testify. That's what we call as your subpoena ad testificandum. But if you will be um, required, no, to bring with you a specific document, um, that's what we call as your um, subpoena duces tecum, because tecum means you are required to bring a piece of evidence. Okay? Duces tecum yan. So that's why C here is the best answer. I think majority, if not all, are actually getting the right answer. Yeah. Bachamuchi, you just need to remember that there can be no two correct answer in every question. Wala pong tamang sagot. I mean, hindi po pwedeng dalawa yung tamang sagot in one question. So I call that as your compatible options. So you immediately scrape all those two options. Okay? So that's actually a hint or a technique that I've been telling my students for a very long time already. So you got that. So let's have another question here. Okay. Yan. Miss Alice Go. Yan. Miss Alice Go has declining condition after being revived yesterday from cardiopulmonary arrest. Dr. Wen, yan, wrote a DNR order. What is DNR? Ano nga bang DNR, kapatid? Department of Natural Resources. What do you think is DNR? DNR is your do not resuscitate order. Ayan. So, simple lang ang ibig sabihin niyan kapag ang patient po ay naging nasa status na ng for CPR na si patient, do not do any heroic deeds. Yan. So this order implies, letter A, the patient need not to be given food and water. Alam nyo si letter A, grabe naman. Food and water talaga. Hindi na bibigyan ng food and water. Grabe naman, walang puso, no? Sabi sa letter B, the nurses and the attending physician should not do any heroic and extraordinary measures for the patient. Letter C, the patient need not be given ordinary care so that his dying process is hastened. Grabe din sa letter C. Letter D, the nurse need not give due care to Joshua, ay nako, even giving bed bath. Alam ninyo, kapag nasa licensure exam na kayo, or even in your examination in your nursing schools, the moment na nakakatawa na ang isang estudyante sa kanyang examination, ibig sabihin, you're actually doing the right thing. You can understand your questions. Okay? So, eto ha kapatid, the best answer here is letter B actually. Okay? So, napakasobra naman ng letter A at letter sabi sa letter A, hindi mo nabibigyan ng tubig at pagkain. Sabi naman sa letter D, hindi mo na paliliguan. Okay, hindi naman puwedeng gano'n, okay? Alam niyo sabi ni Virginia Anderson, a we should give a dignified death. Yan, sabi ni Virginia Anderson, because nursing is nursing is caring from womb to tomb. Yan yung konsepto na meron si Virginia Henderson. That's why Virginia Henderson valued life. Sabi niya, health is a quality of life and is very essential for a person to function fully. Yan. So pagdating sa DNR naman, ang order lang naman diyan is that you should not do any heroic or extraordinary measures for the patient at the point of dying. Yan. Kagaya ng mga cardiopulmonary resuscitations, yung mga ganun. Okay? Yung mga intubations. So, you need not to do all of those things. Okay? Hello po sa ating pong 65 viewers. Yan. Ganyan po ba yung tanungan sa board exam? The answer is yes. Okay? So, I always tell my students how, sabi nila, sir, gaano nga ba kahirap? Ganyan po ba yung mga tanungan sa board exam? The answer is yes. Alam niyo guys, some of these are actually past board exam questions. You please don't think that hindi sapat yung pinag-aaralan mo or vanity lamang yung pinag-aaralan mo, your preparations mo, because it will really give you also the mindset na hindi mo kakayanin in the first place. You think kahit repeater ka, kahit na first timer ka, you think that you will be passing the board exam the moment you sit down in your examination center. Dapat ganun ang spirit po natin. That's where our students fail the board exam because they immediately think na hindi sila papasa. The moment you sit down, dapat ganun na din yung ating pong pag-iisip. That I will be passing this board examination. Yun lang. Simple. Okay? Wordplay sometimes tricky sila. Yes, very tricky sila. Very tricky pagdating sa licensure examinations. However, very plain lang din dapat ang inyong pagsasagot sa licensure questions. Alam niyo pagdating sa licensure questions, this is true, no? According to studies, that the first thing you think about of the options is the first and is actually the correct answer. Yun yung pinaka-tamang-tama na sinasabi palagi. Okay? So, you always do the right way by doing it very simple lang. Simple lang ang atake natin sa ating board exam. Okay? Okay. MP3 and MP4. Yes, of course, MP3 and MP4 because it's where MS. Alam niyo maraming natatakot sa MS eh. Ang reason lang actually bakit na dapat tayo matakot sa MS because you don't know where will our board exam board of nursing will be getting some questions because MS is a very big concept. Medical surgical yan eh. May medical, may surgical. So, yun lang ang kinatatakot natin. Unlike in your OB, kapag sinabing OB, OB na talaga yan. Kapag sinabi nating PALMR, PALMR lang siya. Pagdating sa MS, napakalaking konsepto, di ba? So, that's it. Sir, paano po naging two choices ay parehong word by word? Paano po ba naging two choices ay pareho word by word? Ayan, merong ganyan sa licensure examination and you cannot question the proctor. It's because the proctor has just been um, commissioned by the Professional Regulation Commission. Kumbaga, they were just hired by the PRC to supervise the examination. They don't know at all know about the contents of the examinations. So you just answer the questions plainly. Okay? Kung ano yung sagot mo, yun ang yung sagot mo. Okay? So, ganun lang siya. Yeah. Thank you sa live, sir. More. Okay? So, maybe no, madalas gagawin natin to always, no? And if you are very interested, you can join our licensure examination. You can join our 3-day live review in this coming October 31 to November 2. Very very um affordable lang and then very simple lang din po ang ating atake. It's like boosting all of your morals. We'll be applying also methods to boost your morale para hindi mababa po yung ating mga loob the moment we sit down at the board examinations because the hopes of our student must also be guided with the proper guidance because at the end of the day, no, your licensure examination does not define you as a person. Okay? So, sa mga mostly po na nakikipag-usap sa ating message, repeaters, meron din, of course, no, may mga first timers din. And they've been asking me because may mga students po ako dati na they've been taking the licensure exams for 16 years already. Yung pinakamatagal na alam ko, 16 years eh. No? So, and then they just applied the methods that we've been telling them and we've been teaching them. And they were very successful at that moment. So, yun, it's just a matter of your spirit and your willingness to pass the licensure exams. If this is your second time, this is your third time, then wag lang mawawalan ng pag-asa. Wala namang batas na nagsasabi sa Pilipinas na hindi na pwedeng makapag-take. And for the first timers, of course, you just carry on and apply all those things that you've learned. Okay? So, yan. Okay. MP3 book, sir. Yeah. Yeah. Okay. Sige po. I will be putting down I will be putting down po the link dito po um sa ating pong live, and no, and also of course no, yeah, NB live review. Okay? So if you have I know and I hope and I pray na you are vacant on those days on um on October 31 until it's actually itinaon ko po na holiday po yung ating pong live review so that you would be available on those days, because I don't want also to burden you that this is not a pampalit po no para doon sa mga nasa review centers na. If you are in your review centers, you just continue doing those. Wag po tayong um you just continue your live reviews. I mean your review centers. Okay? Hindi po siya pampalit again sa ating pong review centers. This is to add your preparations, to add up your preparations. Okay? Ayan. I think the same time din po tayo for our live review. We'll be having this one, no? Very nightly basis on nightly basis. Okay? Okay. I hope and I pray, no? Sige. I am trying to HTTPS and of course, yan, yan. Okay? So maraming salamat po sa inyong lahat. I hope and I pray, no? Yeah, magpapas kung may lisensya. Okay? So maraming salamat po for being with me tonight. Ingat po and have a good night everyone.